Hello, my dear students, friends, followers, and dear colleagues. Hope you all are doing good. Today, we're going to talk about some common questions a dentist will face in his life. Common questions. As it is in India, dental doctor is like still under confusion whether dental is a doctor or not. So I made a separate video on it whether dentist is a doctor or not. People have different opinions. People also have different opinions on different aspects of dentistry. So I thought I should take this responsibility to talk on it. I don't judge anything, but I just talk. I'll give my views. Hope if you can try to understand, I'm very, very glad for that. So the first question, what generally a lay person asks a dentist is, what will happen to my eyes, or will my eyes become weak if I undergo extraction? So दांत उखाड़े तो आंखों पे असर पड़ता क्या? This is one thing. और పండ్లు తీస్తే కళ్ళకి ఏమైనా ప్రాబ్లం అవుతుందా? So generally people have this opinion that once you get your teeth extracted, your eyes will get weakened, or you lose your eyesight. So this is general norm people have, and they keep asking us. That too, when you are doing upper teeth extraction, generally people have this opinion that for upper teeth extraction, the eyesight may get affected. So let me put it this way. The answer is no. Your eyesight will never get affected if you are going for extraction of teeth. Number one point. Second is, supposedly you are going for an extraction, you want to know the basis of it, or you want to know whether your eyesight and teeth are linked, because people have this opinion and they come to a conclusion by formulating some theories. They say, when I have tooth pain, all this area gets pain, and this entire area will become painful. So somehow all these nerves are connected, and when you extract a tooth, your nerves all get affected. That's how they have a theory. So let me make it very clear for you that the teeth nerve supply comes from this side, okay, this here, and your eyes has got a socket, and behind the eye socket you will have a supply. So both are on different sides. This is from the pons, this is from the optic chiasma. So I don't find any connection from the optical region to the dental region. There is no relation for the eye and the teeth. Number one. Okay. So your trigeminal nerve, the nerve which supplies the maxilla and mandible, have an ophthalmic part, ophthalmic branch, which supplies the eyelids, eyeball, the lacrimal gland and all. So it is nowhere related to your teeth, because your teeth supply is by the maxillary nerve and the mandibular nerve. Supposedly, if you think that we are going to take out or damage all the nerves, then the nerves are absolutely different when compared to your, supposedly, if you get confused with the word ophthalmic, it is related to eye, that is the lacrimal, the eyeball, the skin on this supratrochlear or suprafrontal, like that. It is nowhere related, and it is not connected to your vision at all, because your optic nerve which supplies for the vision is absolutely protected behind 30 mm behind the the socket, the eyeball socket. So it's not related at all. I don't know who put this in your mind. Your eyes and your teeth are not related. Number one. Okay, this I want. There's no scientific data, or in fact, it is common sense. We don't need this data for this, or scientists to discover this. Your eyes and your teeth are not connected. Finish. Okay. The next important point, general question people keep asking us is, after root canal, do we have to put a cap? Is it compulsory? So people generally ask us, as a dentist, as a maxillofacial surgeon, we, in our clinic, in our college, in everywhere, whenever they meet us, they ask this question: I got my root canal treatment done, do we really have to go for a cap? Yes, after root canal, your tooth becomes brittle, so you have to put a cap. And there is, please don't try to find answers in this. Go for a cap. That's the most easiest, best test, and whatever test you want to put everything. That's a great solution for your teeth. Once you get a good crown done, of course there are different types of crowns in it: ceramic, zirconium, or porcelain fused ceramic, something like that. So there are different materials for it. You can choose based on your budget, but a crown is a must after root canal treatment. Clear? Okay. And the third and most common question people ask is, do we have to really get rid of a wisdom tooth? Oh, people have so many questions regarding it. Wisdom tooth, wisdom tooth. Doctor asks us to remove it. Is it okay to remove wisdom tooth? Is it good to remove wisdom tooth? Will I lose my wisdom? And people have this. They think they are doing. They are very very intelligent. They say, if I remove my wisdom tooth, will I lose my wisdom? This is a common joke what we hear around, and that too, as a maxillofacial surgeon, I keep doing lot of wisdom tooth extractions. I'm specialist in it, and people keep asking me, if I take out my wisdom tooth, will I lose my wisdom, or will I lose my jnanam, or will I lose my brain? No, it's not like that. It's called wisdom tooth because it erupts at the age of 18 to 21. So 18 to 21 is the age where you get your voting rights. People think that that's the age where you evolve and you can make your decisions properly. And 18 is the age where your wisdom, you will start having your own wisdom. So 18 to 21 is a good age. At that age, the tooth erupts. That's why it's called wisdom tooth. Okay, so that's how it is related. And wisdom tooth gets locked, blocked. Sometimes it stays inside the bone. Sometimes it erupts half and stops there. There are so many things that happen with the wisdom tooth. So there can be a cyst formation. There can be an ameloblastoma, unicystic ameloblastoma a kind of benign tumors that form around wisdom tooth. So do not neglect a wisdom tooth pain. I have got a series of x-rays. Series. It's not in hundreds, it's in thousands, where people ignore a wisdom tooth. They come to me after 6 months, 1 year, 2 years, 3 years, and they develop a big cyst tumor, and we have to resect the entire jaw. This is not to terrify anyone. This is the reality, that people are worried to give 5,000 rupees for a wisdom tooth extraction. They keep postponing it. They are worried about it, or they're afraid of extraction, and they postpone it, and then they end up in having cysts and tumors. So it's very very safe. At 99.9% there is no complications, unless some kind of paresthesia, if it is really locking the nerve. Otherwise, generally wisdom tooth extractions are safe if it is done by oral and maxillofacial surgeon. This is also an important point. And people keep asking us these kinds of weird questions, where it is really hard for us to answer, because it is not science, it is common sense, I feel. And it is not a mistake of the patients as well, because patients assume different things because people keep talking to others. So those who spread this, that if you extract teeth your eyes become weak. Yes, my eyes became really weak after extraction. These people have to be really be conscious about what they are talking, and they should not spread. If they have some kind of concern, they should go to their own dentist, talk it out and solve it, rather than spreading it to others, so that those who are in real need, those who are in real pain, they just go to a pharmacy, take a painkiller, take that painkiller, and they subside the pain. They keep that infection in their mouth, and that keeps growing and spreading. So that will cause more harm and damage to you than extracting a tooth. So in case you are worried about your eyesight after extraction, or losing your brain or wisdom after extraction, is all silly and it's not true. Scientifically, there is no data which supports it. Or I've seen this paper long ago, so long ago, that times immemorial, 19s, not even 19s, 1800s, where one person, they in those days they were using this mallet and chisel, where they were hitting it, the lens got disconnected in the jaw. The tooth got logged and they were hitting it hard in those days, in 1800s, not even 1800s, before that, even before that. So people get that information to the current date and they talk. So that's how, lot of information can mislead you, and people generally have this googling tendency. They just google and see what not, the tooth and the cancer, the tooth and the brain, and they get disturbed. So I want you to realize this: your teeth extraction, if it is spoiled, get it removed. If it is hopeless, get it removed and get new teeth replaced there. Okay, hope you understand this. Hope you could correlate to this. And in case you really have anything to talk or anything to ask, feel free to message me, drharish harish tennet at gmail.com. I'm happy to answer all your dental or maxillofacial related questions for free. For those who really want an opinion, please feel free to message me. But if you think that only by just talking or x-ray, if you cannot solve your problem, then I'll ask you to please come to my setup and we will have elaborate discussion and we'll solve it, right? Hope this video will help you and hope this will clear your confusions. And in case you have anything, please feel free to put it in the comment section or mail me. I'll be happy to answer, right? I'll see you in the next video. Until then, please take care and get your vaccine shots done. Thank you.